Paced breathing is a powerful behavior therapy strategy used in dialectical behavior therapy. There's a lot of research showing that breathing really slow, about 6 breaths per minute, can strongly regulate our emotions physiologically, especially when we do a lot of it and thoroughly build it up as a solid skill. Many clients get the advice to take a few deep breaths when they get upset, which may help to some degree, but thorough breathing training will usually make paced breathing much more effective. This video was made to help therapists guide their clients through the process of learning paced breathing and thoroughly explains how paced breathing works. Your clients can also watch this video, or if they prefer, they can watch the shorter version of this video that focuses more on what to do and much less on theory. One of the main principles that makes behavior therapy effective is that it's based on the research showing that behavior change is a really powerful way to change thoughts and emotions. Here's the diagram showing this model of behavior therapy. Of course, emotions often make us do things that match the emotion. When we feel depressed, we isolate, avoid, and give up. When we feel afraid, we tend to avoid the things we are afraid of. When we feel angry, we raise our voices or act mean. It is also true that when we're depressed, acting like a non-depressed person helps reduce depression, eventually. When we're excessively afraid of things, consistently approaching what we fear will eventually reduce our fear. Acting kind, gentle, and empathetic towards a person will reduce our anger. Acting opposite to our emotions can improve how we think and feel. When our emotional reactions do not fit the situation, are excessive, or are not effective. The large box here shows that the internal experience of emotion, the physiology, feelings, and urges, causes emotion behaviors, and also that emotion behaviors influence internal emotional experiences. We feel how we act, and we act how we feel. Here you see how feeling anxious or upset makes us breathe faster, and it is also true that when we breathe excessively fast and shallow, it increases our anxiety and distress, and inhibits parasympathetic activity, which makes the fight-or-flight response dominate. If we breathe like a person who is upset or unable to tolerate a situation, then that will be our reality. When we are physiologically regulated, we breathe slowly and smoothly. When we breathe like a person who is regulated, we activate the parasympathetic nervous system and will eventually become more regulated, meaning we'll be less emotionally triggered or able to recover more quickly. Our goal is to regulate emotion physiology, which involves two related parts of the autonomic nervous system, the sympathetic system and the parasympathetic system. The sympathetic system functions to help us with immediate survival by preparing the body for intense physical activity, to fight or to flee when there is a threat. In contrast, the parasympathetic system helps us effectively engage in behaviors that promote our long-term survival, when there are no urgent situations needing our attention. Here are a few of the physiological changes activated by the sympathetic and parasympathetic systems to help us with these important tasks, relevant for our short-term and long-term survival. Most noticeable to us are probably the changes in our heart rate and blood pressure and our breathing. In addition, dominance of the sympathetic nervous system is associated with low heart rate variability, and activation of the parasympathetic nervous system increases heart rate variability. Heart rate variability reflects emotion regulation and also promotes emotion regulation. This graph shows heart rate variability across a short span of time. This first segment of the heart rate line shows 10 seconds of heart rate fluctuations that would be expected when a person is facing a threat or is upset. But if a person had this minimal amount of heart rate variability most of the time, they would be exceptionally emotionally vulnerable, reactive, and dysregulated. You see heart rate slightly changing with each beat. Faster, slower, faster, slower. At this point, the heart rate is fluctuating between 91 and 93 beats per minute. Now you see heart rate fluctuations when a person is feeling calm and relaxed. Heart rate now fluctuating between 89 and 75 beats per minute. If a person had this large amount of heart rate variability most of the time, they'd be exceptionally emotionally resilient and regulated. Fortunately, there are things we can do to increase our heart rate variability, including self-care activities such as pleasant events, physical exercise, and slow-paced breathing. The first goal of emotion regulation breathing training is to increase your ability to recover from emotion triggers. If you do your resonance frequency paced breathing after a dysregulation episode begins, you can more quickly restore parasympathetic activity, which may result in feeling better sooner after you are triggered. But more likely you will learn to better tolerate your emotions or more effectively handle the situation. When emotion episodes get triggered, parasympathetic activity reduces, which reduces us to simplistic survival thinking. Restoring parasympathetic activity restores your cognitive abilities, which can help you figure out effective problem-solving or coping options. Increasing parasympathetic activity will probably also increase your ability for sustained effort, increasing your willpower, so to speak. The second goal of breathing training is to reduce vulnerability to emotion triggers by increasing parasympathetic activity in general, even when not trying to regulate. Soon after a full session of paced breathing, you will be likely to have a smaller emotion dysregulation episode following a trigger. The episode will probably be less intense, briefer, or less disruptive. If you spend enough time breathing near your resonance frequency, your improved heart rate variability will linger further past the sessions of practice, a lot like when you generally feel better when you have a regular exercise routine. At a minimum, people with severe emotional reactivity may need at least 15 minutes of resonance frequency breathing, at least 4 days per week, for at least 10 straight weeks. But more research is needed to confirm the exact amounts needed. It may be that even more is needed to see noticeable improvements in emotion resiliency. Here we will see how parasympathetic activity, as measured by heart rate variability, changes when a person is emotionally triggered. Following the dashed line, you see how this first person starts off with high heart rate variability, and when the trigger occurs, parasympathetic activity reduces substantially so that sympathetic activity can dominate to prepare the body for fight or flight. The technical term for this is vagal withdrawal, since it's controlled by the vagus nerve. Now you can see when the trigger ends, parasympathetic activity is restored by the vagus nerve, so this is called vagal recovery. And we now see heart rate variability increasing back to the initial level. The second line shows a person with more emotion dysregulation struggles, and you can see a much slower recovery. After a lot of practice breathing at resonance frequency following triggers, this person will be better able to restore parasympathetic activity much more quickly. Following this dashed line, you see how this first person starts off with high heart rate variability, and parasympathetic activity reduces substantially when the person observes this trigger, social disapproval. Now you see when the disapproval ends, parasympathetic activity is restored, and heart rate variability returns to the initial level. The second line shows a person with more emotion dysregulation struggles, and you can see heart rate variability decrease to a much lower level, which results in the peak of the emotion episode being a panic attack. After a lot of practice breathing at resonance frequency, this person has higher initial levels of heart rate variability, so that the social disapproval no longer results in as much decrease in heart rate variability, which results in the peak of the emotion episode being moderate fear rather than panic. This graph shows a person's heart rate fluctuating from moment to moment when the person varies their breathing. This first segment of the heart rate line shows 10 seconds of heart rate fluctuations, when a person is breathing at about 12 breaths per minute. This heart rate pattern is quite normal when people experience episodes of emotional distress, but it would be physically and emotionally unhealthy if a person breathed this fast most of the time. You see heart rate changing slightly with each beat. Faster, slower, faster, slower. At this point, the heart rate is fluctuating between 91 and 93 beats per minute. That's called heart rate variability. In a moment, you're going to see heart rate fluctuations when a person slows their breathing to about 7 breaths per minute, or when a person naturally feels calm and relaxed. Now the person's heart rate will be fluctuating between 89 and 75 beats per minute. even more heart rate variability than before. As the person slowly exhales, the heart rate slows down, the slowest beating at the end of the exhales. Slowly exhaling, and heart rate is slowing down. Now inhaling, and heart rate is increasing to 89 beats per minute. Again, slowly exhaling, and heart rate is slowing to 75 beats per minute. Now, each exhale is slowing the heart rate down by about 13 beats per minute, which is much more slowing than when the person was breathing faster. In a moment, the graph is going to show the person breathing even slower, this time in about 5 breaths per minute. Now the person's heart rate will be fluctuating between 93 and 58 beats per minute, even more heart rate variability than before. Exhaling even more slowly, heart rate is slowing down even more, to 58 beats per minute. Now inhaling, and heart rate is increasing to 91 beats per minute. Again, slowly exhaling, and heart rate is slowing to 58 beats per minute. Now inhaling, faster heart rate. Slowly exhaling, slower heart rate. At almost 5 breaths per minute, each exhale slows the heart rate down by about 30 beats per minute, which is much more slowing down than when the person was breathing faster. Breathing and heart rate are in close synchrony, and the person feels a profound sense of calm well-being. Paced breathing is most effective when a person breathes at their resonance frequency pace, the pace that achieves this optimal physiological regulation. Resonance is when a person maximizes the activation of the parasympathetic nervous system, which is the body's physiological emotion regulation response, opposite to the fight or flight response. Seeing in real time your moment-to-moment heart rate fluctuations is an effective method, as it provides immediate visual feedback about how effectively each exhale decreases your heart rate, and this feedback helps you alter your breathing to get to resonance. This method, called heart rate variability biofeedback, gets you to slow down to your best pace. This graph shows resonance. When a person achieved maximum emotion regulation at the end of 20 minutes of breathing at their resonance frequency pace. Resonance is marked by the largest possible heart rate variability, which for this person was an average of 33 beats per minute decrease in heart rate with each exhale. The more the better. Don't expect to increase your heart rate variability as much as this person, who is showing the best possible resonance for a 20-year-old elite athlete. Most people with a good outcome increase their heart rate variability to about a third or one-half of what this person achieved. The breathing pace that achieved resonance for this person was 5.3 breaths per minute. For this person, faster and slower breathing paces resulted in less heart rate variability. Resonance frequency varies among individuals. For some, it is 7 breaths per minute, and for others, it is 5 breaths per minute. But resonance frequency is close to 6 breaths per minute for most people. In resonance, breathing, heart rate, and blood pressure are in close synchrony, as can be seen in this graph. At the end of each exhale, the person has the slowest heart rate and the highest blood pressure. At the end of each inhale, the person has the fastest heart rate and the lowest blood pressure. With each exhale, heart rate decreases and blood pressure increases. With each inhale, heart rate increases and blood pressure decreases. This synchrony indicates maximum physiological harmony and resilience, which allows the nervous system to deal most effectively with emotional stressors. Here's another view of synchrony between breathing and heart rate when a person breathes close to 6 breaths per minute. The balloon indicates the lungs filling and releasing air when a person breathes in and out. Listen to the sound of the heartbeat and how it speeds up when the lungs are filling and slows down when the lungs are emptying. taking advantage of one's resonance frequency to increase the amount of heart rate variability can be compared with pushing a child on a swing at just the right moment to increase the amount of their swinging. A swing has a resonance frequency, the natural rate it transitions between the back and forth motions, which is 2 seconds for a full back and forth, regardless of how high it is swinging. The swing resists being pushed at a faster or slower rate. A strong push every 1.5 or 2.5 seconds will not increase the amount it swings, but pushing it every 2 seconds will. Similarly, strong, well-timed exhales at resonance frequency increase the amount of slowing of the heart on each exhale, much more than exhales that occur too soon, too often. After pushing down the heart rate, it's as if it swings back on the inhale. Here's an overview of the specific ways to do paced breathing effectively. Breathe at your target pace, your resonance frequency if you know it, 6 breaths per minute if you don't. Many breathing experts recommend you breathe from your lower abdomen rather than from your chest. You can place one of your hands on your abdomen and one on your chest to make sure that during your paced breathing your abdomen is moving but not your chest. Make your exhale longer than your inhale. For example, 4 seconds in and 6 seconds out. It is sometimes helpful to purse your lips to slow down the exhale. When you purse your lips at the start of your exhale, you tighten your lips to make the opening smaller, which means you release the air more slowly. It also creates this sound. And if you focus your attention on this sound, it can help you stay focused on your breathing. Keep your attention on your breathing so that it doesn't as easily drift to disruptive thoughts. One way is to count 4 seconds on the inhale and then count 6 seconds on the exhale. Breathe slowly for at least 5 straight minutes, preferably 10, which will often help you much more than if you do it for only a minute. Be patient and focus on effective coping. In many intense situations, it is unlikely that you will notice much of a difference after a few minutes of paced breathing, and you may not feel better even after 10 or more minutes. The most likely outcome in these intense situations is that you will tolerate your emotion much better and get through the situation skillfully without making it worse. Breathing training done thoroughly likely needs to progress through a series of stages, and you may have trouble succeeding at the final stage, recovering from triggers, if you have not accumulated a solid foundation of practice at the earlier stages. To start, it's useful to use biofeedback equipment to determine your resonance frequency, the breathing pace that achieves optimal physiological regulation for you. Remember, resonance frequency varies among individuals. It may be 7 breaths per minute for you, but 5 breaths per minute for another person. While connected to biofeedback equipment, you can breathe at various paces between 7 breaths per minute and 5 breaths per minute, and a trained therapist can directly observe your heart rate variability and see which pace creates the largest possible heart rate variability for you. To do this, your therapist can go to my website and download the full range of breathing pacers and find biofeedback equipment. Until you find out your resonance frequency pace, just practice breathing at 6 breaths per minute. And if you have trouble breathing that slowly, just do your best to get as close to 6 breaths per minute as you can. Breathing slowly gets easier with repeated practice. It is also useful to measure your heart rate variability at the start so you can later determine how much progress you have made regulating your emotion physiology. At the end of your training, do you have more heart rate variability while at rest? Do you show even bigger improvements in heart rate variability when you attempt to calm yourself compared to when you started? Next, you need a lot of practice breathing at your resonance frequency pace with a pacing stimulus or biofeedback equipment. My website has options for audio pacers, including MP3 files that you can download to your computer or your phone. There are also various YouTube videos that you can watch to pace yourself. In one of my videos, you match your breathing to a balloon inflating and deflating. You can practice with heart rate variability biofeedback with the help of a biofeedback therapist, or by using simple equipment that you can put on your personal computer. The links to a few biofeedback options are available on my website. Heart rate variability biofeedback involves seeing in real time your moment-to-moment heart rate fluctuations, which provides immediate visual feedback about how effective each of your breaths is in decreasing your heart rate when you exhale. Next, you need to practice without relying on breathing pacers, since you will not always have access to your pacers. This type of practice will help you be better able to breathe at your resonance frequency pace in the broadest range of situations. One main way to do this is to frequently practice with my 10-breath pace test. This practice involves timing the duration of 10 of your full breaths when you are trying to breathe at your resonance frequency pace. The duration tells you if you are breathing too slow or too fast, and use that feedback to try again to get even closer to your target pace. Watch my other video to see a full description and demonstration of the 10-breath pace test. As needed, you can count yourself as you attempt to master this task. Finally, you need a lot of practice breathing at your resonance frequency pace in challenging situations to achieve the highest level of skill. Try to frequently practice pace breathing soon after triggers naturally occur. It is also extremely useful for your therapist to help you practice regulating with triggers in your therapy sessions, which is sometimes done during exposure therapy. With the audio pacers you're about to hear, you match your inhale to the first segment of sounds, usually in increasing pitch, and you match your exhale to the second segment of sounds, usually decreasing pitch. The balloon image will show you how to do this with the guitar and flute pacers. As the balloon inflates, breathe in. As the balloon deflates, breathe out. And you'll notice this way of breathing corresponds to the changes in pitch of the guitar and flute sounds. Once you understand how to do this, you can close your eyes and simply follow the sounds in this way. If you don't like the sounds, you can turn off the sound and match your breathing to the balloon. There are also various YouTube videos that you can watch to pace yourself in a similar way. Breathe in. Breathe out. Breathe in. Breathe out. Here's how to get to the paced breathing resources on my website. Click on Current Clients and scroll to the bottom of that page. Here are the breathing pacers, and here are the options for biofeedback equipment and apps. I hope you give this full paced breathing training a try and that you find it helpful. And these skills don't usually build quickly and easily, so I hope you're patient with yourself in the process. Please let me know if you have any feedback for this video.